I finished my fellowship in 2003. So I've been practicing cardiology about 16 years. I've been in Baptist system for the entire 16 years and with the Stern Cardiovascular group. The first and foremost thing that I like the most is when you actually make a difference in somebody's life, or you make a difference in a family's life. When you find something that nobody knew they had, and you're able to fix it before it causes them a problem, or somebody comes in and is complaining of something that's been bothering them and you're actually able to make it go away. I think that's probably the most satisfying part of the job. I spend a lot of time trying to make things better on a more global scale. I'm the director of cardiology here at DeSoto, and I think it's been 6 or 7 years since I took that position. We've made so much progress in our quality and delivery of care, on our registries, our metrics. When compared to the national benchmarks, we're at the very top. So this little place here in South Haven, Mississippi, has the best scores and metrics for management of heart disease than anybody in our area. Right around the time when I was applying for programs, my father he was 47 years old, he had a massive heart attack and died. Because of that, I decided I was going to pursue a career in cardiology. I got into medical school, went to a cardiology program, and on the first day of our cardiology fellowship, we had to learn how to use the echocardiogram machines. So on the first day, we decided to practice on one another, and I volunteered, and when the professor put the echo transducer to my chest wall, he had this big stare, and he said, "What's wrong?" He says, "Well, your heart's enlarged, and you have a atrial septal defect, this big hole in my heart." So finding that hole eventually led to closure of the hole. I had it closed through a percutaneous procedure. I had atrial fibrillation. I got shocked a bunch of times. So, part of it is I got to experience what my poor patients go through every day. The other part of it that was great is, honestly, if my father hadn't passed away, I would have never gone into cardiology. I had other intentions, and I probably would have ended up with a stroke or heart failure. So, it was just pure fate, I guess. When I'm not working, I go to the gym. I go to the gym and I work out, and I try to do it every single day. Part of it is I'm vain. The second part of it is, if I'm going to tell all these people that they got to get up and work out and take care of themselves, and I have absolutely no time in the world to do it, but do it anyway, then they have no excuse whatsoever. I hang out with my daughters and my wife, and we like to travel. I'm from New York, so I try to get back to New York as often as I can. I like to eat. I may not look like I like to eat, but I really like to eat. I love music, concerts, ballet, opera. So I like to live. There are so many incredible things that we're now capable of doing that we were not able to do even 15 years ago. And being part of a hospital system and of a group that pushes the envelope, is on the forefront, is surrounded by doctors who don't want to just settle for what's current but want to always move to the next level, is a fulfilling place to be.